Ready? Hi, I'm Joyce of the Highland Park Senior Producers, and we have two guests for you today. Their names are Mark de Boule. Is that a French name?
It's a mixed name, like a lot of Americans, yes. Boule is how you pronounce it.
Okay, and Carly Manis. They're independent insurance agents that broker healthcare. They represent senior healthcare coverages mainly. I guess, is that the only thing you cover from?
We do a lot of things, but that's how most of our focus is, the senior market.
The senior market, so this should be very interesting for the seniors that are watching because they could get some very helpful hints. I have. Not hints, information, I should say. So, you want to start talking about it now?
I'd be happy to.
Okay.
And thank you very much for having us.
Oh, you're welcome.
We're honored to be here.
Thank you. Thank you very much.
Senior show on YouTube
and DVD and television and what else can you ask for? I'm waiting for my Academy Award, but
I can't help you there. With your senior health care, perhaps.
Oh, okay.
Well, thank you for the introduction, too.
Okay, you're welcome very much.
And I'd like to just talk a little bit about who I am and where I come from and why I'm here in the North Shore.
Yes.
I married a gal from Highland Park. She and her family grew up on Sunset Road, right across from Sunset Woods. Born in Highland Park Hospital.
Oh, yeah.
I spent a couple of decades, a lot of time in Highland Park and the surrounding North Shore.
Oh yeah, I love Highland Park. I used to live in Chicago until I came here because I had relatives and friends here.
It's great town and great area.
Oh yeah.
I've been doing a lot of my work lately in the North Shore and around this facility. I'm originally from Boston.
Oh, you don't sound like you have an accent.
Thank you.
Not at all. The R's, aren't they different? The R's.
Having an R in my name has helped me to focus on trying to shed a little bit of that New England sound.
Oh, okay.
And it's been a long time.
Not at all. I don't detect anything.
It's been a long time. If I hang around with some New Englanders, it might come out.
Oh, so do you live in the city now, did you say?
I live in Chicago now.
Oh, so I don't know if you'll get this on TV.
I don't know. I've seen you on the internet.
Okay.
On the YouTube channel.
Oh, yeah, so you know how to do it. Some of the older people, you know, don't know how.
I think it's really nice what you do. It's very informative for seniors.
Yeah.
And they can tune in and learn things from a local producer right here, another senior in their own community.
Yeah.
And that can just be a wonderful resource.
Yeah.
Anyway, I have been living in Chicago on the north side near Evanston for a long time, but I've spent, as I say, a lot of time in Highland Park and in this North Shore area.
Oh, okay.
And now for a number of years through work, visiting with seniors in here in this area. But I've been an independent insurance producer for about 40 years.
Oh, really?
And for the last 10 or 15, I've been focusing on Medicare recipients and seniors. And again, a lot of it is in this community. So again, thanks for having me today. Some of the folks watching this may recognize me from visiting communities and facilities or their homes even.
And come to buildings and have tell them all about it. Like it's really interesting. A lot of people showed up at that last time. I was surprised.
Yeah, you see, Medicare and healthcare in general can be very confusing. There's a lot of details, and it really needs to be tailored towards an individual's needs. So I try to go out and give a basic overview or understanding about starting with Medicare, and sort of break that down and then get into further details as it applies to each individual. But it's not to be the guy who hogs the mic. I'd like to say, again, thank you for having me, and I'd like to give my colleague Carly Manis a chance to tell us a little bit about where she comes from and what she does.
Okay.
Yeah, so I've been in Chicago for about a year and a half now.
Oh.
Yeah, doing insurance for going on 7. So really focusing more on senior-based needs, like Medicare, the different changes going on with it. So love Chicago. It's been a great transition so far.
Where did you come from before that?
I was born and raised in Indiana, so not too far.
Not far.
Fort Wayne, about 3 hours.
Fort Wayne. My father, he's not living, he was in Indianapolis.
Okay, yeah.
Yeah.
It's a good city. So, just working around in the Chicago area, a lot of the suburbs, and going through some of the changes that we'll be talking about today, and how it impacts Medicare recipients and what they're looking for to help kind of find the right fit for their goals and their needs and their different healthcare issues. So, yeah, we partner with a lot of the different plans that are sponsored by Medicare and that help people in different health stages, financial situations. So it's been good, really able to customize the needs of people and really find a fit.
Yeah, I once worked for Fireman's Fund. Are they still around? I doubt it.
I haven't heard of them in a while.
It's a long time ago.
Yeah, I think, I remember them, but I haven't heard about them, so
Well,
I think
worked
maybe
at
not.
13 different places, American Express, all over. I like to find out something new. That's why I go on to new places always. How did Sandy know about you?
Sandy, gee whiz, how did I meet Sandy? She's a great gal.
Oh, I know, such a helpful
Oh,
person.
I went to help a senior in that building that over in Deerfield,
Yeah,
the
yeah.
Osterman building.
Yeah.
And I went to meet with a lovely lady. After
yeah.
meeting with her, I went down into the lobby and just wanted to introduce myself to Sandy.
Yeah, that's a
And
nice building.
She just said, you know, I'd really like it if you'd come do a whole presentation for our
Oh,
building, and then
right.
after that, can you come to these other buildings?
Yeah, one thing led to another.
She
Yeah.
runs a lot of buildings.
Yeah.
They're
You
all.
have such nice blue eyes.
Oh, thank you.
I should be saying I had libo. He's staring. I could see
Keep it
that's
fun.
all I see is his eyes.
Well, thank you.
Again.
So to shift the focus back
Yeah.
towards what we do, I'd like to just take a quick second because some seniors are just turning 65, or perhaps have become 65 in the last few months, and they can, or before 65, they can be unaware of what Medicare is and how it works.
Yeah.
When you've been on Medicare for a number of years, you figure stuff out by trial and error, or someone like myself helps you. But just as a generic overview, Medicare is based on 4 parts.
What are they?
Those are, they're labeled with letters, so they're parts A, B, C, and D, and it pretty much works like this. Medicare Part A is given to everyone with no charges once they reach the age of 65, automatically, by the federal government. You've actually paid for this through your taxes. Now, this is pending you've worked enough and you're a legal citizen and all of that. And Part A is designed to protect seniors when they enter a hospital.
Oh, yeah.
So A is for hospital. That's an easy way to
that's-
remember that.
Yeah.
If you need to go to the hospital and you're on Medicare, Part A is going to be the coverage that you're going to use. They mail everybody what they call a red, white, and blue Medicare card with your name and an ID number on there at 65. Unfortunately, they also send you a Medicare and You booklet, which is very confusing and hard to
I
understand.
misplaced my card again. I have to
We
call
can, we
again.
can always
Order
order a
another one.
second one for you.
It's not the second one, the third one.
Well, you're not pushing your luck. There's no limit. We can always replace them. I can help you with that.
Age.
So that's sort of the very basic description of Part A.
Oh, okay.
Following that is what they call Part B. It's easy to remember Part B because Part B, the word that would correlate with that best is doctors.
Oh, yeah.
Or you can say medical. That's what it reads on the information. But it's when you visit the doctor. That's going to be the part that you use the most.
Right.
So when you go to a doctor instead of the hospital, Medicare Part B is going to kick in and take care of that.
Now things are so different in the hospitals and
I know.
everything. My doctor won't. She said they're not going to tell me what to do. She's independent. Yeah.
It varies with different doctors. It varies by region, and it varies by person to some extent. Some of the basics are universal all over the country.
Oh, I see.
The federal government says, for example, if this is going to be a certain benefit that's offered, all these insurance companies that are providers must offer the same benefit, for example.
Oh.
Everybody's going to get their Part A no matter what. Now, other parts that plug into the puzzle later on are going to vary by age and region or area. So it could be a little different in Lake County than Cook County.
Oh, really?
And certainly different if you were in Missouri or California compared to Illinois.
Right.
And that greatly affects the drug coverages as well.
Oh, yeah.
So you come to the third part, which can be called Part C. And that's when you need some other insurance to pick up the 20% that Medicare
yeah.
doesn't cover. 'Cause
The
Medicare,
supplement, right.
yeah, Medicare covers 80% of your costs, but there's that 20%.
Does
So
it have to be the approved amount?
Yes. Yes, there are some plans that will pick up extra amounts, but that's, again, a little more complicated.
Okay.
When you get to Part C, it's sort of difficult to explain because it's not really a supplement. It's Medicare Advantage or a supplement. So when you're done with receiving your Part A and your B, you come to a fork in the road, and you need to decide if you would like to take a Medicare Advantage plan and
yeah.
forfeit your benefits from the original A and B Medicare, in which they assign you some carriers to protect you. There's certain advantages to that. Or you can choose to take the other path that's offered, which is to use an independent company to offer what they call a Medicare supplement or a Medigap plan.
Oh, yeah, that's probably what I have.
Those are slightly different than Part C. The unfortunate part for people as far as understanding goes is the Medicare supplements are also labeled with letters.
Oh,
So then you can have a supplement, Plan A, Plan C, so on and
is
so
that
forth.
the one that's F and all those?
F,
things?
F high deductible, you're right.
Something with the grandfather is
Yeah,
going to
that's
happen now?
that's
or-
the government often comes in and says after a certain amount of years, we're not going to offer this particular lettered supplement on the market anymore. We're going to replace it with a new one. So they replace the F with a D, for example, is how they call it. And some of the folks that are on plans that are being discontinued, the government offers them a grandfather clause so they can keep what they have if they want. But I try not to get too much into technical details, particularly in this situation here, because again, it gets tailored quite uniquely for different people, and it can get confusing if you keep going down a path with those. It's best to do like a skeleton or a bones examining and understanding of how the different parts work, and then when there's an issue or a person that I'm speaking with, we can delve further into C, D, F, high deductible, so on and so forth. So to continue along, so it stays simple. The next is going to be Part D.
Oh, yeah.
D
Is that the medicine part?
it's the drugs. I always say
Yeah.
D for drugs.
Okay.
It's easy to remember that.
Yeah. Oh, yeah.
That's the D for drugs.
Yeah.
The D is a separate part. Again, it's the fourth part. And that is a separate company that's going to pay for your drug coverage when you pick up your prescriptions at the pharmacy.
Oh,
Okay? And they all vary too.
oh, okay.
They vary by your age, by the company that's underwriting it or providing you with the coverage, by the drugs that you're on, by the area you live in, and where you go to buy those drugs.
Oh, really?
So you may be.
What does the area you live in have to do with it?
The government goes by. It's not by zip code. It's hard to explain how they cut the regions up. It's not always
They look
by.
at it, as regions. They kind of segment it.
Oh.
And so for the greater Chicago area, they have over 24 different plans.
Oh, really?
So really depending on where you're at in the state or traveling around, that is going to help dictate what's going to be the best plan for your specific prescriptions.
Oh, yeah, it's really so much involved and people don't realize. Like,
It's very regulated.
with F, is it true that then they pick up the balance or something? On the with the doctors.
Yeah,
plan.
so with the
Yes.
Medicare supplement, you have your A and B for your doctors in your
Yeah.
hospital.
Yeah.
That still has like the 20% in out of pocket.
Yeah.
The supplement is going to work to pick up most, if not all, of the remaining bill.
Oh,
So in that case, you can go to any doctor that accepts Medicare,
yeah.
and then they will pay the remainder of your bill or a portion of it. And then your prescription plan goes to just cover your drugs. So with the supplement, that has the letters that Mark was talking about. And a couple of the plans are going to go away at the end of this year for new recipients.
Can you
to
have
Medicare.
like the F of one plan and then D on the drugs from different insurance companies?
Yeah.
Yes.
Oh, okay.
Oftentimes that happens
Oh.
because one prescription company may cover insulin better and another may
Oh,
cover
right,
inhalers. So
right.
depending on your prescriptions in your pharmacy, one plan may save you a lot of money out of pocket, or it might cover your drugs better. So it's really good to review it every year during the fall. That way you know what your plan looks like for the following year, because the drug plans can change in your cost and the pharmacy networks and your co-pays and premiums.
Now, what exactly does ARP have to do with any of this?
ARP is just, as you know, American Advancement of Retired People, or American Association of Retired People. I'm an ARP person.
Because like
remember
that D you could get through ARP or
You can.
dental
What they do is
plans or-
they just partner with, usually in this area, it's United Healthcare.
Oh, I see.
It's just an ARP-sponsored thing.
Oh.
And another thing that Carly mentioned, she's right. It's very important. A lot of people don't do this, but you should review your Medicare benefits, your supplement, and particularly your Part D for drugs every fall.
That's one thing, like, I think I'm paying too much for.
The formulary, which is the list of all the medications and all the amounts of each drug and each pill, let's say, changes every year.
Because besides the premiums, you still have to pay part of the medicine.
Right.
That's right, and those can change.
Yeah.
Sometimes you might find that the last 5 years your insulin or your metformin was covered in a very small couple dollar copay at Walgreens.
Yeah.
And for some reason the drug companies have switched the formulary for the year, and suddenly next year you're going to find out that it's going to not only maybe not be covered, or there's going to be a higher copay, or you might have just done a lot better by switching from the Walgreens over to the CVS or whatever
really?
that might
I
be.
didn't know. I got an email that says I'm no longer on our Part D, and that's crazy because it's automatically deducted. So I went in there and they said no, I should send them a copy of it. You're covered, you know.
Yeah.
You need to have someone, we could do that for you, someone to look at that, because there's a lot of explanations or reasons why that may have happened.
Maybe even the same name. You know, the hospital gave me somebody with my name, their lab test, and I discovered
that could
they
happen.
were mad at me when I brought it back. They were so rude. I'm not going to say where or who or when, but yeah, it's a good thing I looked at it. The person was in the emergency room. She was even older than me, and it wasn't me.
Well, we encourage people to review their Medicare,
Oh,
all of it, each
right.
year in the fall, because that's when you have your open and your annual enrollment periods where you're allowed to examine what's coming up for next year.
Oh, yeah.
Set changes in place that would take effect for January 1st, and then once you hit that date, for most people in most circumstances, that's what your coverage is going to be for, let's say in this example, 2020.
Oh, yeah.
You do that in the fall of 2019, which is rapidly approaching in about another month or so.
Oh, right.
And that's the time people should take advantage, because that's when the government allows you to say, I looked at this and it's going to change, and I want to make these changes. You do the paperwork. Starting January, you will have the coverage that you have changed for. And Medicare recipients and seniors should really do this every single year, because if they don't, what happens is either the pricing gets very, very high, and then they're sort of stuck for a little bit, or maybe one of their drugs aren't covered, and this again becomes another negative as far as cost goes. It could be a health issue.
What about pre-existing conditions?
Well, that's
more with the doctor thing, right? Isn't
That's
it?
going to depend on what company you're looking at for the supplement.
Oh.
Some ask more in-depth health questions than
see.
others.
I see.
So usually there's something that we can find that even with pre-existing, there's a plan that people can qualify for, just depending on what it is and what their age and gender is, which is the basis of a lot of the premiums. So really the only thing that fluctuates with Medicare supplements are your premiums.
The thing is, both Carly and I are independent, and we're contracted with most all of the providers for Medicare. And that's important too. I'm not trying to promote myself here.
Did you want, if people have questions, can they call you?
People can feel free to call either one of us at any time. I'll state my phone number if you'd like now.
It's up to you, yeah.
My direct cell is 773 208 0706.
Okay, because people would probably have questions. It's
only complicated.
Changes every year and everything.
Yes, and sometimes there's personal information. We can't do certain things by law over the phone. So we often meet in people's homes or at a local coffee shop if they prefer.
Yeah.
Sometimes it's not just privacy, but a lot of times Medicare recipients, seniors, anybody for that matter, may have health issues that they're a little bit embarrassed about, or would just rather speak privately, or perhaps their finances. They don't want to share that in a public setting or what have you. If you contact someone like myself or Carly, that is independently contracted with all of the providers,
Okay.
you then have the ability to look at all of the different plans that are available and select the one that works the best for you, whichever company that may be. And you may get the greatest Medicare supplement, the greatest drug coverage through Blue Cross or whatever it is. And your twin sister living next door may be way better off with a different company, Mutual of Omaha or something like that.
Yeah.
It really has to be tailored individually.
Mutual of Omaha. There was a problem, like people didn't want to accept it, or doctors or
I can't
something.
really talk on a recorded thing
I
about
know.
specific companies. I just want to use those names as examples because they're
Yeah,
relatively
yeah.
popular in this area.
Oh, right.
But Carly mentioned there's 24 prescription drug providers in this
Oh,
area.
really? Oh.
We're licensed with almost all of them.
Oh.
The point being, an independent person like one of us has the ability to say, these are the different companies, these are the different programs, give it a recommendation that looks based on the drugs that you've told me you're on and your health and this, that, and the other thing. This may be something that's going to work for you. We can also help by going on to some government websites like Medicare.gov, which is a great site, and several others. And look up where it might be best for you to purchase your drugs, for example.
Yeah, there are different prices depending upon
Oh, yeah.
where you go.
You could have a drug plan from one company, and we can show you. If you get your metformin, again, for example, at Walmart's, here's what it's going to cost you, and here's what it costs at Walmart, here's what it costs at CVS.
Okay.
You may want to say, I'll drive the extra block or mile or whatever
yeah.
to save X amount on
What
each.
about when people are on Medicaid? Is that's something different, right?
It's different. Medicaid's different, yeah. There's certain parameters that have to be met for someone to qualify for Medicaid.
Oh.
And then it's completely different. Carly, you can speak about that a little bit.
Yeah, so Medicare is the the government program for health care for seniors.
Right.
Medicaid is the government program that helps with income displacement. So for lower income, that's going to help provide health care for people under 65 or pick up certain health-related expenses for people who don't have the assets to afford it or the income.
A lot of people can't even find doctors that are on Medicaid.
Yeah, and there's specific doctors and networks. And with the new macro laws, it is affecting the Medicaid, the different state programs as well,
right.
just as far as their different programs that they're offering. So really depending on, again, someone's situation.
I have a friend that's on that, and she gets to see a doctor immediately. I could maybe have to wait a couple months. You know, it depends upon the person asking, I guess.
Yeah. And some doctors take Medicaid, others do not.
Yeah.
I know a lot of the facilities around here are very busy. It takes a while, just in general, to get an appointment.
Yeah.
So that's not necessarily on a plan-to-plan basis, but depending on, again, the route you choose with a supplement or Part C with the Advantage plan, that a lot of times can dictate the time frame of when you can see a doctor, if you need a referral, if there's networks, or if you have more choice and freedom in your care.
Yeah, I know. I go to different doctors and different cities even.
Yeah, and a lot of people want their coverage to travel with them, which can be a big thing if you're on a network-based plan and you leave the network.
Yeah.
So those are a lot of issues that people...
you could talk on this.
Oh, yeah, you
Because
could.
I know we don't have that much time, 5 more minutes only. I can't believe it already.
And we just barely scratched the surface.
Yeah, I know. You'll have to come back.
Well, I guess we'd be happy to. We're up in this area a lot. And I feel like I owe you an apology because I'm a big blabbermouth. And I feel like however long this show was, I've hogged down quite a bit of it with my own talking.
Well,
Carly's my colleague, and she's highly qualified.
Oh, I'm sure.
I actually look up to her in quite a few areas. She's very good. By the way,
she'll forgive you.
should we have your phone number too? So if followers want to give a buzz, they can call you too.
My cell phone is 260-438.
438?
Yeah, 438-8856.
Okay.
If you guys have specific, coverage questions, Medicare in general, where Medicare leaves off a lot of times with, as seniors are living longer with chronic conditions,
like
there's a lot Medicare doesn't cover.
People live so much longer now than years ago. I remember, I don't know how many years ago, somebody was 80. It was unbelievable. 80. Like a freak. No,
Same thing comes up with the donut hole. Right?
Yeah, that's another area.
Carly?
Yeah, so that is another topic that the new macro laws do address. So the donut hole is basically when you pay up to a certain amount for prescription costs. Your copays start at one area, maybe it's $1 or $2 if it's generic, and then once you hit a certain threshold, your cost goes up for certain generic drugs or depending if it's brand name. So if you see your prescription costs go up mid-year or it doesn't stay consistent, you probably go into the donut hole where you have to pay more now out of pocket.
Oh, I see.
It is getting smaller.
Yeah.
And so for next year, hopefully we will see it diminished and that will keep more level copays, hopefully for people. But yeah, that's one area that they're really trying to get rid of because it can cost seniors thousands.
Oh, I know. Yeah, after a certain amount. Yeah.
But it's again it's a giant iceberg. We barely touched the tip.
I know.
I want to encourage any seniors, particularly in the North Shore, if you have questions, feel free to call either one of us. Again, Mark DeBoule, 773-208-0706, or Carly Manes, 260.
438-8856. Yeah.
There you go.
Okay, where did I write
And
your
we'll be
phone
happy
number?
to answer questions on an individual basis and help if we can.
Was this it? 773-208?
0706 is me.
773, downtown is 312. Oh, but you're not
just-
downtown.
No, I'm north by Evanston.
Oh,
up
I
by
see,
the lake
okay.
in East Ridge.
Oh, okay.
And Carly, this is Indiana number? Yeah,
Indiana.
from
Oh,
Indiana.
oh,
Her cell
okay.
phone from Indiana.
Okay,
Yeah.
okay. We only have a few more minutes. It's been so informative so far, and you really will have to come back. I'm sure people will be calling you with questions. I mean,
It's getting to the busy time of year now. You know, in the fall, in the next 6 weeks, the enrollment period comes up again. So
people slipping in ice and
And if anyone has questions about the plans that are being taken off the market
that's
or some of the
important,
new
too.
plans
Yeah,
that
I'd
were
like
introduced.
to learn about that too.
Yeah,
You have not classes, but you meet at different areas and explain to groups of people,
And
right?
another tip I would give anyone who is in this situation: don't wait until December 28th to make your choices. Try to do it a little bit earlier.
pay your bill
It starts
or-
in October. You can make your changes. Start then if you
Okay,
can.
yeah.
You get a lot of people. It's like an accountant. If you bring your taxes on April 14th, he's going to try to
Like
get them in on
somebody
time.
I know is going out of town and she packed already. I packed the night before, you know. Yeah, so this has really been so informative. I can't thank you enough for coming on
for having
and talking about it. And you could look forward to coming again. We'll
Super.
figure out a time and day, okay.
We'd love to.
Good, I'm very glad. So, thanks so much.
And thanks for
Yes,
having
thank
us.
you.
Yeah, and so,
We look forward to round 2.
okay, round 2.
All right.
Okay.
Sounds great.
Yeah,
Now we can
thank
get out there and enjoy this lovely weather. We've got a
Yeah,
beautiful
it's
summer day
nice today, isn't it? And
Yeah,
I
it's
took a
very
buzz.
nice.
I don't know. I guess it is.
A long, cool, damp spring.
Oh,
I'm happy for this weather.
springs are never like spring. I don't know. They're usually cold or something.
My grass is very green.
Oh,
I'm
that's
happy
good.
about that.
Oh, okay.
A lot of rain this spring.
Oh, yeah, that's true. That's very true. And you don't live in Indiana, or do you still?
Oh, no, I'm in the city.
Oh, okay, that's good. I lived in the city up till 20 years ago. Different
We're
building.
both north side and by the lake. I'm about, a couple of miles north of you?
I was usually downtown. Hancock was my last building here. And downtown I moved around a lot, but tired of moving already.
Yeah.
Yeah,
You're
so.
tired of moving the second time you move.
Oh, I know. Yeah, so where do you go from here now? You have other appointments today, you
Of course,
say?
oh yeah.
Like
Pretty much every day.
every day.
Try to take some time off on
I think
Sunday.
you enjoy it, though. You both do.
It's wonderful.
Yeah.
I mean, you meet nice
A lot of people, yeah.
And,
Oh,
and you visit
right.
them in their homes and you help them and you develop friends and nice relationships. I couldn't even begin to, it's another iceberg. How many seniors that we visited that invite us back and back
Oh,
and
yeah.
back for dinner and
Oh,
who
really?
knows
Well, I
what.
won't go that far.
Well,
Unless you like from microwaves.